Hello everyone, my name is Robert Johnson. I am a nursing student with Nightingale College. Today I'm going to be performing a skill with administering ophthalmic medication, eye drops. First things first, I do have my uniform on, my ID badge, including my shoes. So first things first, now that I'm at the facility, I'm going to go ahead and wash my hands, make sure my hands are cleaned. And from there, I'm going to check the physician's orders. And I'm going to be checking that against the electronic health records. What I'm checking for is the 6 rights. I'm checking for to make sure that it's going to be the right patient, the right medication, the right dosage, the right route, the right time, and the right documentation, right? Everything looks good on the 6 rights that I checked with the medication. And so with the electronic health records and the physician's orders. Now I'm going to be checking the medication against the electronic health records. And when I check the medication, I'm going to be checking a total of 3 times throughout this scale, right? So, first of all, the doctor's order, this is an order for timolol. It's going to be 0.25% solution, 1 drop in each eye twice a day, right? So now I'm going, as I said, I'm going to go and check the medication against the electronic health records. Once again, I did the 6 rights for that. That looks good as well. That's the first check of the 3 checks that I'm going to be doing. Now from there, I'm going to go ahead and gather my items. I have washcloths, I have gloves, and also I have the eye drops, and I have the tissue box. I'm going to go ahead and go into the patient's room, lay these items down on a clean, dry, flat surface, put them there. If I have to provide a clean surface, I will by putting the towel there first, and then put the items on top of that towel. Now I'm going to go ahead and introduce myself to the patient. Hello, Mr. Jones. My name is Robert. I am a nursing student from Nightingale College. I am here because your doctor has an order. There's an order for you to receive ophthalmic medication, eye drops. But before we begin, let me go ahead and wash my hands and provide you some privacy. Now from there, I'm going to pull the privacy curtain. Pull that curtain. And I'll go to the sink, wash my hands. Hands are clean. Okay. Now that my hands are clean, dried of course, I'm going to go ahead and put my gloves on. And then from there, gloves are on, and I will go ahead and talk to Mr. Jones. Mr. Jones, can I please check your ID on your wristband, and can you please verbalize your name and your birthday? Okay, Raymond Jones, birthday March 10th, 1968. Thank you very much. Now that Mr. Jones has verified his ID, who he is from the ID band, and also verbalized, I'm going to go ahead and check the electronic health records again. This time I'm checking the medication. I'm checking his name against the medication and against the electronic health records. Everything looks good on the 6 rights. Okay, that's my second check of the 3 checks I mentioned. Now from there, before I go ahead and go any further, Mr. Jones, do you have any allergies? Are you allergic to any foods, any medication? Do you have any seasonal allergies? Mr. Jones confirmed he has no allergies at all. From there, I would explain the medication. Mr. Jones, you're going to be receiving timolol eye drops. This is in order for you to receive 1 drop in each eye twice a day, and the amount is going to be timolol 0.25% a solution for the eye drops. And I would also explain to Mr. Jones that there may be a burning sensation or a stinging sensation when they receive the eye drops. I would also explain to Mr. Jones that this medication, the way that it works, this medication is a beta blocker. So how it works is that it is to relieve the intraocular pressure of your eyes. Also, there may be some side effects that Mr. Jones needs to be aware of. For example, it could be blurred vision. Also, it could be some sensitivity to light. I would explain that to Mr. Jones. I would also explain to Mr. Jones that this medication could also have some adverse effects or some adverse actions to it, including chest pains. It could be shortness of breath, or even rapid heartbeat, tachycardia. If you feel any of these side effects or any of these adverse actions, Mr. Jones, I would explain to Mr. Jones to please let us know as soon as possible, and then that way we'll be able to address it. Do you have any questions about your medication or any of the side effects? No? Okay. Mr. Jones confirmed he has no questions. So now that I confirm everything's good, no allergies, I brought washcloths. I'm going to go ahead and set Mr. Jones in a lower them down to about 30 degrees to flat. Some people may use flat. I'm going to bring them down to about 30 degrees. Mr. Jones, what I'm going to do first, I'm going to clean your eyes. I brought 2 washcloths for that. I'm going to, these are warm, wet washcloths. I'm going to go ahead and clean from the inner canthus of the eye to the outer canthus. Clean. And get rid of that one there. Now, separate washcloth for separate eyes. I'm going to clean from the inner canthus of the eye to the outer canthus. Good. Put that in the hamper. Okay, good. Now, before I administer the eye drops, what I'm going to do is I'm going to check one more time, the third time, checking the medication up against the electronic health records. And the MAR, everything looks good. Still the 6 rights. Everything's consistent. With the tissue, what I'm going to do is I'm going to hold down the conjunctival sac with the left hand, and with the dominant hand with the eye drops, I'm going to rest the dominant hand on the forehead and pull down the conjunctival sac and install 1 drop into the eyes, into the conjunctival sac. Okay, 1 drop. Okay, release the sac and then just kind of massage a little bit. There, medication's in there. Get a brand new tissue. Okay, same thing. By the way, I would have asked Mr. Jones to look straight up. It's important that I mention that. If I didn't verbalize it, I'm making sure that I'm verbalizing it. I'm going to hold down the new tissue, hold down the conjunctival sac, ask Mr. Jones to look straight up in the air, look straight up. I'm going to rest my hand, dominant hand, on the forehead and install 1 drop as he's looking up into the conjunctival sac. 1 drop, okay. Release the conjunctival sac and just massage a little bit. Make sure it's there. Okay, good. How you feel? All right? Okay. All right, there. So from there, I will go ahead and I'll go ahead and bring Mr. Jones back up to a comfortable position. I will wash my hands and give the call light, and then I will go and call light, wash my hands, and then I'll go and document the skill. All right? Thank you very much.